Male pattern baldness accounts for more than 95% of all hair loss in men and impacts almost half of all men by the age of 50. Today, we make our way over to the North Shore, where one doctor is tackling the issue at the root. Dr. Kaiwan Brown of North Shore Medical and Aesthetics Center says that his crusade against balding began at a young age.
Hair loss runs in my family. Some of my uncles are thinning as well. And so I started to have effects of hair loss in my late 20s. And now I have to keep on doing treatment in order to keep it. If not, nature will take its course. Scientifically, what happens is that the hormone testosterone gets converted to dihydrotestosterone at the level of the hair follicle. At the level of the hair follicle. And this causes destruction and miniaturization of this follicular unit. So this follicular unit starts to lose its blood supply as a result of the effects of the hormone and starts to shrivel up and die in regards. And as a result, it doesn't produce hair. Normally it produces 2 to 3 follicles, hair strands, and it starts to produce 1 and then it starts to produce nothing. And that's just the evolution of the effects of dihydrotestosterone. And if you notice, with men, it's only on the crown. It's only in our receding hairlines, but it's never really on the sides. And the sides are just, for whatever reason, genetically predisposed to the hormone. There are some people that, of course, they're genetically predisposed due to family history, and there's some that are not. And it may just skip a generation. But it's recognizing the signs that, okay, my hairline is starting to get thinner and thinner. My barber is taking my hairline back and back. All the things that we experience as young adults going through these changes in regards to our hormones and our hair. And then recognizing that there's help available and there's treatments. It's possible to save it, and it doesn't take a whole lot to do so.
A number of treatments to combat male pattern baldness have cropped up over the decades. Some are more effective than others.
The most common is that treatment called minoxidil, and we've actually compounded it into a formulation that doesn't give rise to symptoms that people normally experience when taking like the Rogaine over the counter. But it's like growing hair, it's like growing plants. As I tell patients, you need sunlight, you need nutrition, and you need blood supply or water. And pretty much the treatments that we employ here at our hair and scalp disorder clinic cover all those 3 realms. Your face and your hair is your presentation to the world. And so just like how people are afraid of having acne because people normally tease them with it, and you can in your male circumstances, male be like, oh, what's going on, cousin? Your hairline's going backwards. And there's some teasing and around that does affect people's self-esteem. So it's definitely something that's important, and it's about acknowledging it, acknowledging the signs. Having a barber that's astute to recognize, hey guy, you're actually starting to have some thinning and some miniaturization of these hair follicles, and directing you to services that can help you. Such as us. We are one of those clinics. We are Bermuda's first and only hair and scalp disorder clinic. And we treat all ranges of hair loss, from male pattern and female pattern hair loss to those who are suffering from psoriasis or seborrheic dermatitis. It's another one which people normally say is dandruff. So all these different ranges of hair loss we treat here in our clinic.
Hair loss is not a gender-specific condition. While male pattern baldness is the most prevalent form of hair loss, Dr. Brown highlights the growing number of women patients suffering from female pattern hair loss.
As we talk about hair loss and we talk about hair loss treatments, it's just like growing plants, right? So we need nutrition. And in this case, we've developed hair, skin, and nails that I formulated myself that gives your body the key nutrients that it needs in order to grow and stimulate hair growth. Just like baking a cake, it's just not eggs. You need other things in order to bake a cake. And so people would go to this pharmacy and run and get biotin. Biotin is just one item, it's like eggs, and you're gonna need others. So we have a full list of nutrients that help to stimulate hair growth. The other thing is blocking that DHT, so dihydrotestosterone, and this is a natural DHT blocker that we've formulated with saw palmetto and some other herbs. And then we have what we call the watering, if you will. The watering helps to, these are drops, so don't think of the drops as being water, because they're not. But what they do, they increase blood supply to the scalp by causing blood vessel dilation. So we're going to get that oxygenation through blood supply. That's how we actually nourish our hair follicles, and the nutrients are going to come along with it. And then as well as the DHT blocker that's going to block the conversion of dihydrotestosterone at the level of the hair follicle. We have this gentleman with alopecia areata, and that's a hair loss that's autoimmune. It's caused by the immune system, and it creates a very well circumscribed patch of hair loss. Men, women can have it. They can have it on their beards, on their facial hair, as well as in their scalp. And this is a 3-month comparison showing before and after treatments. Many of our treatments, we take pictures either at 6 months, like this particular lady has traction alopecia because she was using braids and these sorts of things, and she was technically pulling out her hair during the process of braiding. And over time, got very patchy, diffuse hair loss that within 6 months we was able to fully restore. This particular lady here has what we call CCCA. CCCA is an autoimmune inflammatory condition, and that's just caused by perms, excessive styling, perms, hot combs. She probably used hot combs back in the day, excessive perming and these types of things. And the patient that would present with this particular condition would have that lack of hair growth in the crown. When they're getting their perm treatments, because I know my mom used a stylist, and I used to see the ladies walking around the house with the perm in their hair, you know, tapping their scalp. It was really being overdone. And as a result, this is where this disease takes place. So stylists must be able to look at the package insert for that particular product and follow directions as prescribed by that particular company. This lady here had advanced alopecia areata, and that's that well circumscribed patch of hair loss. And you can see the white hair starting to return, and that's the new growth. It starts off white or gray and then repigments thereafter. And you can see after 6 months, 3 to 6 months period, we have a full restoration.
In addition to seeking mainstream forms of medical treatment, stopping or preventing hair loss starts with healthy habits.
There's all sorts of things that one can do. There's also laser light therapy that people go and buy these laser lights off of Amazon that work. There's other sort of topical herbs like people use rosemary, rose hip oil, these types of things, castor oil, Jamaican black castor oil to be specific. These things do have a benefit. And so if men, if they're trying to moisturize their scalp, I say, yeah, use one of these things because they're going to add to the therapeutic benefit. Adequate nutrition, you know, eating fruits and vegetables and protein, most important. Some of our vegans are not getting enough protein. As a result, keratin is a form of protein, and they're gonna just have thinning of their hair as a result of lack of nutrition. The other thing is sleep and stress, very important. Your hair actually grows at night. The hormone melatonin stimulates hair growth as a process, and the patients who are suffering from insomnia also start to have some challenges with hair growth. Stress, as I just mentioned, stress causes problems with everything. Smoking as well has an effect on hair growth. And then some medications as well. So for those patients who are taking cholesterol medications, diabetes medications, or hypertensive medications, they can also have some hair growth challenges as a result. But do not stop your medication, please, by all means. Do not stop the medication. But there is treatments that we can add on top of that, because that would not be advantageous to have a heart attack trying to save your hair.
Grae Miners for News Extra.